Hi, I'm Madge Candia and I am going to present a study on the MMPI clinical scale scores on consensus diagnosis of schizophrenia. The determination of a diagnosis to a specific disorder is a key function on the practice of psychology, specifically on the field of clinical psychology. However, in order to provide reliable diagnosis of mental health or other clinical issues, a psychologist must be able to utilize and implement the appropriate tests to the client. One commonly known test is the Minnesota Multiphasic Personality Inventory, developed by clinical psychologist Stark Hathaway and neuropsychiatrist Charlie McKinley in 1937, which they referred to as an objective aid in the routine psychiatric case workup of adult patients and as a method of determining the severity of the conditions. The MMPI was designed to help provide relevant information to aid in problem identification, diagnosis, and treatment planning to a client, implementing it in order to identify personal, social, and behavioral problems in psychiatric patients, which may involve the evaluation of disorders such as post traumatic stress disorder, clinical depression, and schizophrenia. In addition, it was also utilized in job screening and other non-clinical assessments, such as the purpose of criminal justice and corrections. It also served its purpose in supporting for college, career, marriage, and family counseling. The MMPI was an objective personality test considered to be very frequently used. Yet, despite extensive utilization of the test, revisions were implemented by the 1970s as many of the content of the items were considered outdated or offensive, thus brought about the addition and development of new items and new skills through the MMPI-2 along with the Minnesota Multiphasic Personality Inventory Adolescents or MMPIA, which was collected from adolescent normative data in relevance to the adolescent specific scales it was constructed for. So the most recent MMPI revision is the MMPI-2RF. Nonetheless, the MMPI-2 contains clinical skills and validity skills that were nearly identical to the original MMPI. The skills under the original MMPI were consecutively hypochondriasis, depression, hysteria, psychopathic deviate, masculinity, femininity, paranoia, schizophrenia, schizophrenia, mania, and social introversion. These are all under the clinical skill again. Since the study will only focus or cover up the clinical skills, I will might as well introduce to you the definition of the clinical skills. But do know that the validity skills of the MMPI are LFK skills. Hypochondriasis identified patients who manifested a wide variety of vague and nonspecific complaints about bodily functioning, which dealt with somatic concerns or general physical competence. Depression assessed the primary characteristics of symptomatic depression, which included having a poor morale, lack of hope in the future, and a general dissatisfaction with one's own life situation. Hysteria identified patients who demonstrated hysterical reactions to stress situations. Psychopathic deviate identified patients diagnosed with general social maladjustments. Masculinity femininity identified homosexual invert males. Paranoia identified patients who were judged to have paranoid symptoms such as ideas of reference, feelings of persecution, grandiose self concepts, suspiciousness, excessive sensitivity, and rigid opinions and attitudes. Psychasthenia measured characteristics which involve excessive doubts, compulsions, obsessions, and unreasonable fears. Schizophrenia identified patients diagnosed as schizophrenic, which included bizarre thought processes and peculiar perceptions. Social alienation, poor familiar relationships, difficulties in concentration and impulse control, ambivalent or constricted emotional responsiveness, lack of deep interests, disturbing questions of self worth and self identity, sexual difficulties, and possible misinterpretations of reality, delusions, hallucinations, and withdrawn aggressive, or bizarre behavior. Hypomania identified psychiatric patients who manifested hypomaniac symptoms characterized by elevated mood, accelerated speech and motor activity, irritability, flight of ideas, and brief periods of depression. Lastly, social introversion assesses a person's tendency to withdraw from social contacts and responsibilities. Studies have examined how the MMPI predicted psychological problems. One study examined whether the MMPI predicted medical students' psychological problems, which included perceived stress, anxiety, depression, and interpersonal difficulties. The results concluded that symptoms such as anxiety and depression were predicted by the psychopathic deviation, psychasthenia, and schizophrenia scales and perceived stress was predicted by the schizophrenia scale, which proved the relevance in using the MMPI in order to identify risk of developing psychopathology. Another study aimed to examine the personality characteristics of individuals with schizophrenia through execution of the Minnesota Multiphasic Personality Inventory or MMPI. The researchers studied 73 parasite offenders diagnosed with schizophrenia and 104 comparison schizophrenia patients who completed the Korean version of the MMPI. Through the test, the researchers acquired results where the parasite offender group showed significantly higher scores on L, F, HS, HY, and PD, and may have developed hypochondriasis, hysteria, and psychopathic deviate than the comparison group. They made use of the regression analysis, which indicated that PD and SI significantly increased the odd ratio of the sexual offender group, suggesting the difference on the psychopathology between the two groups despite being diagnosed under the same disorder. Conversely, the current study made use of an archive data which included a sample of twins from the population of Washington University. Through ordinal logistic regression, this study examined how significantly the Minnesota Multiphasic Personality Inventory or MMPI clinical scale scores predicted the consensus diagnosis of schizophrenia. The data was derived from an archive acquired from Gregory Carey's compilation of multivariate statistics datasets, one of which consisted the dataset of Washington University twins with the description, consensus diagnosis of schizophrenia, and MMPI clinical scale scores. The twins were treated as an individual. Each 402 members of the twin pairs was an independent observation and were tagged under one of the following. So, 0 consensus diagnosis outside of the schizophrenia spectrum, 1 consensus diagnosis of schizophrenia spectrum disorder, and 2 consensus diagnosis of definite of probable schizophrenia. The test utilized to the sample was, of course, the MMPI, which I already introduced earlier. Each item within the MMPI was written in the form of a self-report inventory to which the respondent would choose among true, false, or cannot say. Each scale had different possible score ranges as caused by the variation in the number of items. This was addressed through the linear transformation of the raw scores to t-scores, which converted each scale to the same measurement unit. So again, the data was acquired from an archive that consisted of 402 samples from Washington University. So as I've introduced, each sample was labeled among 0, 1, and 2. These scores of the raw scores obtained from the participants' results on the MMPI were not corrected, however, for K. So of the 402 participants, 83.8% were under 0 or outside of the schizophrenia spectrum. 6.5% were within schizophrenia spectrum disorder, and 9.7% were diagnosed as having definite probable schizophrenia. Ordinal logistic regression was performed using SPSS for the data analysis. Ordinal logistic regression would make it possible to examine and determine which of the MMPI clinical skills predict the diagnosis of schizophrenia. Assumptions were considered upon proceeding to verify how the given data fit the model. The consensus diagnosis of schizophrenia among the participants were measured at the ordinal level, while the T scores from the results of the samples, a multiphasic personality inventory or MMPI, were measured at the continuous level. The coefficients table, as you can see in the PowerPoint presentation, produced that all tolerance values of the clinical scale scores were greater than zero point 0.1, and all VIF values were less than 10, which assured the collinearity of the dataset and that no two or more independent variables were highly correlated with each other. The assumption of proportional odds was met, as assessed by a full likelihood ratio test comparing the fit of the proportional odds location model to a model with varying location parameters. So, thus, each independent variable had the same effect for the cumulative logit. So, as you can see, all of the assumptions were met. So, we can proceed with the results of the test. So a cumulative odds ordinal logistic regression with proportional odds was run to determine the MMPI clinical scale scores that predicted the consensus diagnosis of schizophrenia. As shown here, the deviance goodness of fit test indicated that the model was a good fit to the observed data. Likewise, the Pearson goodness of fit test also indicated that the model was a good fit to the observed data. The other table, or containing the model fitting information, shows that the final model statistically significantly predicted the dependent variable over and above the intercept-only model. So, as shown on the SPSS table containing the parameter estimates, we can see that an increase of T-scores under the PD, PA, PT, and SC scales were associated with an increase in the odds of consensus diagnosis of schizophrenia. So, in summary, the MMPI clinical scale scores that may predict the diagnosis of schizophrenia include psychopathic, deviate, paranoia, psychasthenia, and schizophrenia. So there were previous studies which had similar results with the current study. A study which investigated the Minnesota multiphasic personality inventory characteristics of parasite offenders with schizophrenia in Korea had two comparison groups who both had a diagnosis of schizophrenia. So, this one, if you've noticed, I already introduced this sa related literature review sa introduction, wherein the results of the logistic regression analysis showed that the clinical scale best representing the characteristics of the parasite offender group among the MMPI scales was the PD and SI scale. So, the parasite offender group also showed significantly higher scores on the clinical scales of HS, HY, and PD and may have developed these characteristics, thus included the psychopathic deviate. As with our results, the study claims, however, that the paranoia and schizophrenia scales are the major scales observed in schizophrenia with that study's control group, which is also a schizophrenia group, who also had high PA and SC scale scores. The schizophrenia and paranoia subscales of the MMPI were actually considered to be characteristics of schizophrenia and were expected to be found with individuals having schizophrenia. In addition, a study regarding MMPI measures as signs of predisposition to mental disorder among adoptees at high risk for schizophrenia concluded that high scores on the psychopathic deviate scale predicted psychiatric disorder at 11-year follow-up. stating that mental disorders could be predicted with MMPI scales psychopathic deviate. A previous study on the MMPI and Rorschach indices of schizophrenic and depressive diagnosis among adolescent patients also supported the claim that MMPI scale SC elevation was found to be the most effective single predictor of schizophrenic diagnosis, with a hit rate of 0.76, sensitivity of 0.62, and specificity of 0.78. So another study also concluded that the MMPI's usefulness for identifying schizophrenia premorbidly. In relation to this, a study which investigated the MMPI profile characteristics of schizotypal personality disorder. Schizotypal personality disorder patients showed significantly elevated PT, which you've noticed earlier in the results of the current study, where PT or psychasthenia was included, and SI scales compared with the schizophrenic patients. As we may remember from our undergrad classes, schizotypal personality disorder and schizophrenia may appear similar, but there are differences between the two diagnoses. So, people with schizotypal personality disorder typically don't experience hallucinations and delusions. But people with schizotypal personality disorder are open to the idea that their ideas and perceptions are distorted. However, a person who exhibits symptoms of SPD earlier in life may go on to actually develop schizophrenia, thus supporting the aforementioned claim that MMPI may be useful for identifying schizophrenia's premorbidity. So here are my recommendations. As you may have noticed with some of my related literature, and as some of us may all be familiar with, MMPI is a test that has been around for a long time. Naturally, many tests have already been developed, which included Myers-Briggs Type Indicator, NeoPI-R, a newer version of MMPI-2, which is MMPI-2, RF, 16PF, and Eysenck Personality Questionnaire. So, future studies may then investigate on how these tests determine the personality characteristics not just of individuals who have schizophrenia, but individuals who have other mental disorders as well. My acquired dataset also had participants who, on the majority, belonged outside of the schizophrenia spectrum. With that being said, the current study might have been more reliable if not all, then there was a bigger number of individuals with schizophrenia. Consequently, tests such as MANOVA could be performed in order to determine the difference between the personality characteristics of the individuals without schizophrenia and the individuals who are diagnosed with schizophrenia. And lastly, schizophrenia actually as a disorder is broad. Future studies may then examine the different personality characteristics among individuals who are diagnosed under different types of the disorder through but not limited to the MMPI. So this actually ends my presentation. Um, I hope you find my study well, and feel free to comment on the things that I need to improve on to. Thank you so much.